Setting: Hospital Accident and Emergency Department. You see a 40-year-old patient who was coming to the emergency department with a burn on his foot, which caused by dropping an iron box on it while ironing some clothes this morning. You have just examined the foot before he sees the doctor. You confirm it as a superficial dermal burn. Now let's see the task. First one says, confirm the presence of blistering and few white patches, and it is superficial dermal burn. Second one says, find out if he has tried any remedies such as cleaning or pain relief. Third one says, find out if he has any signs of shock such as dizziness, nausea or fever. Fourth one says, outline the next steps: examination by the doctor, dressing the burn, etc. Explain the possible treatments for blistering. Example: leave alone, aspiration of fluid, removal of top layer of the skin. Advise that decision regarding the treatment taken by the doctor. Sixth one says, advise superficial dermal burn takes 14 days to heal with minimal scarring. Seventh one says, reassure the patient about the next steps. Prioritize case, pain relief to be administered later, doctor to address concerns. Last one says, establish patient's willingness to wait for the doctor. Now let's begin the role play. Thank you, Mr. Joe, for your kind cooperation to examine your foot. Based on my assessment, I understand the presence of blistering along with few white patches. It is a superficial dermal burn, which means it is a first-degree burn that affects only the outer layer of the skin. But don't be overly concerned. This can be effectively manageable with some treatment modalities. Before proceeding further, I would like to know a little more about your burn. Is it okay with you?
Okay, nurse, please go ahead.
First of all, let me know what happened exactly on your foot.
Nurse, it happened today morning. I was just ironing my dresses, and in the middle, the iron box fell on my bare foot accidentally. That's how I got this burn.
I'm really sorry to hear that. I also appreciate you for coming to the emergency department for the medical assistance. I know it must be really painful. Mr. Joe, after the incident, did you take any measures to manage your burnt area, such as cleaning or dressing?
Nurse, I was really scared after the incident, but I put some ice packs on my burn site and I covered it with a plastic wrap and I reached here immediately.
Okay, Mr. Joe, did you take any pain relief medications to manage your pain?
Yes, nurse, I took a paracetamol to manage the pain.
Thank you, Mr. Joe, for sharing those details with me. Now let me explain you the next steps of the treatment. May I proceed?
Okay, nurse.
First of all, there will be a detailed examination of your burn by the doctor. Then, after the examination, he may prescribe some treatment procedures, which includes dressing the burn site. By the way, may I know if you have any signs of shock, such as dizziness, nausea, or fever?
Yes, nurse, I was a little dizzy after it happened. However, I did not have any other symptoms.
Okay, Mr. Joe, I'm happy to hear that you do not have such symptoms.
Nurse, how are you going to treat the blisters?
Your concerns are reasonable, Mr. Joe. Let me explain to you in detail. There are various treatment options are available to manage the blisters. That is, if the blisters are minor, we may just leave it alone. Small blisters usually heal on their own because the skin over the blisters helps prevent infections while new skin forms underneath. Then, if the blisters are major and fluid filled, then we may aspirate the fluid. Then we will remove the top layer of the skin and provide dressing to prevent the infection. However, the final decision regarding the treatment will be taken by the doctor. And do you have any questions for me?
How long approximately should I wait for the recovery? Also, let me know if there will be any scars on the wound side.
Your thought is sensible, Mr. Joe. Usually, the superficial dermal burn takes almost 14 days to heal completely. However, there will be a minimal scarring on it, but do not worry. Those scar tissues fades over time. Do you have any more questions?
Can I meet the doctor now?
Okay, Mr. Joe, your concerns are completely understandable. As you know that this is an emergency department and the doctors are currently busy with patients. They usually meet patients based on the priority. But don't be worried, I can assure you that your case will be prioritized and some pain relief medications will be administered. Then your concerns will be addressed by the doctor. So I request you to wait for the doctor until he is available. I hope you are willing to wait for the doctor until your turn.
Sure, miss. I can do it.
I appreciate your willingness to wait for the doctor, Mr. Joe. Do you have any more questions for me?
No, nurse. Thank you.
Okay, Mr. Joe. I hope I have clarified your concerns and queries. You please be seated here for a couple of minutes. Doctor will attend to you shortly. In between, if you have any more questions or concern, you can just let me know. I'll be glad to help you. Thank you, Mr. Joe, for your valuable time. I wish you a speedy recovery. Thank you, guys. Our role play ends here.